My name is Miss Rhonda Hickson, and this is Miss Jana Beckman, and we're instructors here at ASU Three Rivers. And today we're going to do and go through the head-to-toe assessment for you guys. Probably one of the most important checkoffs that you're going to have, the one that you're going to be doing every day in your nursing career. So let's get started. So for the first part of your general survey, this is that time to get to know your patient, that time to maybe even chit-chat and form that therapeutic relationship. So I'm just going to walk through this for you guys as if I was coming into the room. So knock on the door. We're going to provide privacy, right? And I'm going to introduce myself to the client. And so I would say, hi there. My name is Rhonda. I'm going to be helping your primary nurse take care of you today. I'm actually a student nurse at ASU Three Rivers in Malvern. And she's asked me if I could help her with your assessment today. And so I would like to do that for you if that's all right with you.
That's fine.
Yeah. So Miss Beckman says, okay. And I can proceed then. So what do you do next? I'm going to wash my hands, right? We're going to wash them really good. Little time lapse here. And then I'm going to check her armband. And so I'm going to look at her armband and I'm going to say, can you tell me your name and date of birth?
Jana Beckman, 11/13/84.
Okay, and so that matches my records. And so the next thing I'm going to do is ask her about her pain. Are you having any pain today?
No, ma'am.
And the one thing that I want you to understand about this general survey, it's what you can observe more than anything. And so at this point, I can look at Miss Beckman and I can see if she's well kept. I can see kind of her effect. You know, does she look sad? Is she happy? Is she acting erratically? So I can observe her behavior as well. I can look and see how she's breathing. So ABCs, you're always going to hear ABCs, airway, breathing, and circulation. So this is something that we can do in a pretty quick manner. So I can obviously tell that she's in no distress. She has an open airway and she's circulation is good. She's not in any sort of distress. I can also observe at this time, is her hair clean? You know, does she have any body odor? How well kept is she? So that's one of the things that we're going to look for as well. Just basically her state of health, you know, how well does she look? Is she exhibiting those signs of pain? Is she guarding or doing anything like that? And so one of the other things that we would do at this point is, I'm going to walk around the bed, is we're going to check any sort of equipment that she has. And so we will look to make sure this is the perfect time to check your pump to make sure that everything is working in order, make sure everything is flowing correctly. I also will give a glance to the IV at this point. If she has an NG tube, we would check that. If she has cardiac leads, we want to check that. Any sort of equipment that's on her at this point, we want to make sure that it is in good working order. And so I would also like to thank Miss Beckman for allowing me to take care of her today. So for our head and neuro check, we're going to first assess if the client is alert and oriented ×4. And what does that mean? So that means, are they alert to person, place, time, and situation? So I do this by asking the client, can you tell me your name?
Jana Beckman.
Mm-hmm. And what's your date of birth?
11/13/84.
And do you know where you are today?
I'm in the ASU Three Rivers Skills Lab.
Yeah. And so what is today? What's today's date?
4/27/20.
And what brought you in today?
I am just in the hospital for monitoring.
Good. All right. And so we also at this point look at her verbalization and how is she speaking? Is she speaking clearly? Is her speech slurred? Is she understanding and following commands? We can also understand her hearing at this point, because if she's responding appropriately when we speak to her, we can assess that at this time as well. Now we're going to check grip strength. And so, Miss Beckman, can you squeeze my hands? And so I will put 2 fingers in each hand and have them squeeze. And we're checking to make sure that their grips are equal on each side, that they do not have any deficits. When checking strength in the feet, you would have the client push against your hands like pushing on a gas pedal, and then you would ask them to pull back. Very good. And so in the same manner, we're checking for that they are equal on each side and there's no deficit on one or the other. And for the purpose of judging paresthesia, I would then ask the client, are you having any numbness or tingling in your extremities?
No.
Okay. So our next step is checking PERLA, which is an acronym that we use for pupils, equal, round, reactive to light, and accommodation. And so this is kind of a complex thing that we do, but we're going to go in and talk about each one. What I want to see when I shine the light in front of the client's eyes, in front of Ms. Beckman's eyes, I'm going to do a minimum of 2 passes. You don't want to linger in the eye because that can cause some pain from that light. So 2 quick passes. And then what I'm looking for is, are the pupils equal? Are they consensual on both sides? Are they exactly the same size? Because if one was larger than the other, then that could be an abnormal response. The other thing that I'm looking for is reactive. Are they constricting with this light? So they should constrict when a light is shone into their eye. So that pupil should constrict and get smaller. Constriction is getting smaller, dilation is getting larger. And are they brisk? Are they doing it rapidly? And it should be rapid. It should be fairly rapid. Sometimes it will be sluggish, and that's going to be indicative of an issue as well. And then accommodation is, when I will show this in a minute, but what we are looking for is the pupils will constrict the closer we get to the eyes, and when we pull away, they will dilate. So we were looking for that, and we are also looking for that consensual response as well. So each eye should be doing it equally. You can ask the patient to cover one eye, and then, again, 2 movements and change eyes. 2 movements, again looking for that constriction. And then for accommodation, I'm going to ask Ms. Beckman if you will look at my pen light, and as you move it in, you're looking for that constriction, and as you move it out, you're looking for that dilation or accommodation. And then we'll finish up our neurological assessment by looking at the head. And so you look at the scalp, look at the hair. We're going to look in the ears for anything abnormal, both ears. We also look at the mucous membranes. So into the mouth, ask them to stick out their tongue, and then in the nostrils as well, just to see if there's any abnormalities. And next body system that we're moving to is our cardiovascular system. So the first thing that we're going to do is listen for our apical pulse. We're going to listen for the rate and the rhythm. We want to note any irregularities in that rate or rhythm. We want to document regular or irregular. We also will find it at the 5th intercostal space. So you can count down through the ribs and find that space between the ribs. And it is going to be that mid-clavicular line. So that means it is from that mid-clavicle bone down. And we find that apical pulse by finding, we start at the mid-clavicular line. So we find her clavicle bone and we count down 1 space, 2 space, 3 space, 4 space, 5 space. And so always make a note that before you touch a client's breast or touch them in this area, that you ask permission first. So I would say, Ms. Beckman, is it all right if I touch you in this area?
Yes.
And so you have to be, sometimes a person who is large busted, you might actually have to lift that breast with your hand to get to that apical pulse. And so once we find that spot, and remember, you're going to have to verbalize where this spot is, we're going to listen to that pulse. And for purposes of assessment at the school and on a live person here, we're doing it over the clothes, but you would actually be listening to the skin itself. And so that spot would be right up under there. You would listen for 1 full minute. And for checking the cardiac valves, you need to be prepared to not only show where you place your stethoscope stethoscope, but you need to also be able to verbalize where it goes. So for our aortic valve, it is the right second intercostal space, just lateral to the sternum. So we are going to find that intercostal space 1 and 2. Find the sternum, and it is just going to be lateral to that. So we'll be listening for any sort of abnormalities, for any sort of murmurs, S1 or S2. And then the pulmonic valve, it is going to be the left second intercostal space, just lateral to the sternum. And basically it is just directly across from your aortic valve. And again, listen. And then for our tricuspid valve, it is inferior left of the sternal margin. And so basically it is just down, about right there. And then our mitral valve is in the same place that we listen to our apical heart rate. It is at the apex of the heart. And again, it is the fifth intercostal space, mid-clavicular. So you find that clavicle bone and you move down intercostal space, 2, 3, 4, 5. And it again is just going to be right under that breast. We're now going to check for edema. And we do this by lifting and looking at the calves, the lower legs. What you're going to do is you're going to press gently for 5 seconds. And as you press, and you can do it at the same time, and then let up. And what we're looking for is any indention that is left from that. And so if you get less than 1 millimeter, or around 1 millimeter, then we're going to term that as a trace amount, or +1. +2 would be 2 to 4 millimeter indention. 3+ would be 4 to 6 millimeter indention, and 4+ would be 6 to 8 millimeter indention. You can also move down if it's noted around the ankles. For capillary refill, you must remove any socks. And what you're going to do is you're going to press gently on the nail bed. Press down and hold up. What you will see is it lightens up or whitens. And then as the blood flows back into that nail bed, it should become pink again. And so what our normal is less than 3 seconds. If it takes longer than 3 seconds, then that is an abnormal response and indicates a poor peripheral blood flow. And then we'll do the same thing with the hands. And for our final assessment in our cardiovascular system, we're going to be checking for pulses. And what we do is we check these pulse points for deficiencies by comparing one side to the other. So we're checking bilaterally. We will start with the carotid artery. We will check there. This is the one I do not want you checking bilaterally, because if we do, you could actually cut off some blood supply to the brain. So we're going to check this one side, and then the other. And so it's really under that back of that jawline, and you just press gently to feel. Next, we will move down to our brachial. And so we're going to move down here, and really it's kind of in the bend of that arm. You just feel around until you feel it on that client. And again, you're checking for equality. And then we'll check that radial pulse. And always make sure that you're using your first or second digits and not your thumb. If you use your thumb, you can actually feel your own pulse and misjudge it. And then we move down to the femoral pulse points. Before we do this and touch a client in this area, you need to ask if it's all right if I can touch you here and take this. And so, Ms. Beckman, is it all right if I touch you here and check for this femoral artery?
Yes, ma'am.
And so what you need to do is if they refuse, and they can refuse, you just document unable to assess. And so that femoral artery site is right there in the bend of their leg. And sometimes you may have to feel around until you get it. And then as we move down, we're going to go to the popliteal. And so the popliteal is actually behind the kneecap. And this one sometimes is difficult to find. And so you're going to assess again at the same time. Feel for any deficits until you feel it. Equal. And then you're going to move down to the posterior tibial. And so it is just medial inner aspect of the ankle. And so you find that spot. Both sides again. And then the last one is your pedal pulse. And so I'm going to take off Miss Beckman's socks one more time so you can see this spot. So the pedal pulse is directly on top of the foot. It's usually between the two bones, and sometimes you really have to search to find it. But when you do, if it's a person who is really hard to find, you might actually even mark that with an X for the next person. So moving on to our next body system, it is going to be respiratory. And so we note how they're breathing. Are their breath regular? Is it unlabored? Are they having any sort of audible from here wheezes or anything that we note that is irregular? We also want to look and see if they're wearing oxygen at this point, and if so, note how many liters they are on. That is something that we would be charting as well. We're going to ask the client, have you had a cough? Have you had a cough, Ms. Beckman?
Yeah.
So that's good. And then we also notice any secretions, if runny nose or anything like that. When auscultating the lungs, we start with the anterior side. And so we start first, we find that clavicular line, and you're going to listen right below that. And on the anterior side, we're going to do it for 6 spaces. And so there's a way that we do. We listen first on one side, and then we move across to the next. And we listen for 1 full breath in and out for inspiration and expiration round. And then we move down the next intercostal space. And then we move across the chest to the same area so we can compare that. And then down again. And across, listening for those lung sounds. Then down again. And cross. Going down each intercostal space. Down again. And across. And then for the posterior, we will have Ms. Beckman sit up. When checking the posterior sign and auscultating the lungs on the back, you're going to have that client sit up if they can. If they cannot sit up, then they may need to be assisted up from that lying position. And if they cannot sit up at all, then you may need to roll them. Checking the back is very important, and often it is forgotten. And so there are actually 8 spots down one side for a total of 16 spots. And so you start at the top, and again, that stethoscope goes between each intercostal space. If you have it on top of a rib, you're not going to be able to hear those breath sounds. So right again below that mid-clavicular line, you're going to start. You're going to start listening to the first one, move over to the second one, down on that same side, and then across. Three, And again, you listen for one full round of inspiration and expiration. When checking the lung sounds down the sides, you need to understand why there are only 2 on the left side that we listen to and only 3 on the right side. The left side is taken up by the heart, and so there are only 2 lobes on the left side of the lung. And so under that axillary area, you're going to listen, and then you're going to listen a little bit farther down to that second lobe on that left side. And when listening on the right side, there are those 3 lobes. And so the first one is right up under that axillary area. The second one is a little more anterior. And the third one again is lower and a little farther back. Again, listening for a full inspiration and expiration. And then what you will document is those breath sounds. You're going to identify how many lobes that you hear and what breath sounds go in, or what breath sounds you heard in each one of those lobes. You're going to document whether they are clear, whether they're coarse, crackles, wheezes, rhonchi, whatever you hear. But make sure that you can document what lobe you heard that abnormality in. For our gastrointestinal assessment, we do 3 things in order. We always look, listen, and palpate. So what are we looking for? We're looking for any distension. We're looking for anything abnormal. We are looking for any guarding with pain if they're having abnormal abdominal pain. At this point, we would also note if they had an ostomy, a PEG tube, or an NG tube. So we're looking for that. You would assess that ostomy site as well at this point, or any PEG tube site. And then the next thing we do is we listen. We're listening for those bowel sounds, those tinkling noises that we hear. We're going to begin in the lower right quadrant, and you're going to move clockwise to the lower right, to the upper right, over to the upper left, and then the lower left. And when we listen, we are listening for 1 minute and comparing that. So we would document an active bowel sound is anything between 5 and 30 sounds per minute. We would document a hyperactive bowel sounds, anything greater than 30 a minute, and if they are extremely loud. We would document a hypoactive if we only heard maybe 1 bowel sound, 2 bowel sounds every 3 to 5 minutes. And then we would document absent bowel sounds over 5 minutes. And so that means that you do not hear any bowel sound for the length of 5 minutes. So you might actually be listening for a full 20 minutes if that person is suspected that they have no bowel sounds at all. And so we demonstrate that. So again, you listen for 1 full minute on each side. I'm just doing a time lapse. And then after listening, we're going to palpate. We're going to be looking for any sort of abnormal masses or bulges. And so again, you're going to start in that lower right abdomen, and you're going to press gently but firmly. You'll ask the client if they have any pain with that.
No.
And move up. But again, feeling for any sort of masses, bulges, hard areas. We want to note if the abdomen is soft, if it is tender, or if it is hard. We also want to question the client about if they've had any nausea, vomiting, diarrhea lately. We want to know if they are continent of stool, and so we would ask that question as well. And as well as when was the last bowel movement that they had. So we would document that. That is very important to document in your nursing practice. We also kind of want to know what's normal for you. And so we would question that client a little bit later. We might also ask the color of the stool, the consistency, and go into detail a little bit. When assessing the genitourinary system, first we start by asking the client if they need to empty their bladder. Do you need to use the restroom?
No.
Okay. And if they do, then we need to assist them to the restroom. We also ask them, are they able to empty your bladder fully, and do you have any pain when you do so?
No.
Okay. We can also ask them if we haven't seen it, maybe they're coming into the ER, maybe they haven't been here before. We ask them about the color, the smell, was there any blood, that sort of thing, if we can't see it ourselves. And then we also, when we palpate the bladder, please note that we should not be able to actually feel the bladder when it's empty. We are actually trying to feel for a distension of the bladder. And when you do that, again, we're going to ask that client, do you mind if I touch you? And they're going to say yes or no. And so right above that symphysis pubis is where you're going to feel. And you are going to press firmly but gently to feel if you feel that bulge above that symphysis pubis. And so if you do, then you would document that you can palpate the bladder. We would talk a little bit more about, are you continent of urine? Do you have any problems voiding or holding your urine when it's time to go? We would ask again, just like we did for the stool, when was the last time you voided? And maybe even talk about at this point about making sure that you void in the hat so we can monitor that. We're going to note again that color and the odor as well, and look for if it's clear, yellow, amber, if it has hematuria or blood in it, if it's cloudy. And also this is the time that you check those Foleys. And so if they have a Foley, you're going to check that it's hanging properly, that it's attached to the bed properly, that is attached to the client's leg properly. And again, note what the urine looks like in that Foley and the amount. And for our next body system, we're going to check the musculoskeletal system. So we start off by checking joints. We look at all the joints, ankles, comparing them, make sure that there's no swelling, tenderness. We also look for contractures. You can have them turn their neck as well to make sure all of it is not painful. We are going to check range of motion as well. And so we'll have the client lift their leg. Can you lift your leg, Ms. Beckman? And just move them through that motion. Make sure that they can move all of those extremities in those joints. And we're going to do the same thing. Thank you. See how Ms. Beckman is doing? You would ask your client to do that for you. And then for strength, and when checking strength, what we're going to do is ask that client to raise your leg. And as they raise their leg or arm, you're going to give a little bit of a push. And so that's going to be your resistance. And so when we document strength, it is a scale from 0 to 5 out of 5. So if you document a 0, they have no movement at all, no contractions, nothing. A 1 out of 5 is a visible contraction. So maybe, can you demonstrate that? And so maybe just some movement or some contraction, but no movement with it. If you documented a 2 out of 5, you would have some limb movement, like maybe across the bed, but nothing up. So nothing against gravity. If you documented a 3 out of 5, then you're going to have some against gravity, but no resistance. So they may be able to lift their arm, but they can't lift it if you're pushing against it. If you document a 4 out of 5, you're going to have some resistance. So they may lift it a little bit, but you can tell their strength isn't fully there. And then a 5 to 5 documented would be full strength, no weakness at all. And so let's demonstrate that. And so Ms. Beckman, can you lift your leg? And can you lift this leg? Okay. And this arm. And this arm. Very good. And so we also look at body symmetry and alignment. Alignment, especially in your client who is has a decreased level of consciousness, maybe they're not moving and they're bedbound. This is very important. You want that body alignment, their head to be in line with their body, whether they're turned on their side or they're sitting up in bed. So body alignment and symmetry is important. We checked strength earlier in our neuro assessment, but again, you can check it again by having them push against you. So strengthen those that is equal strength. And so again, we can check the grips. Make sure that those are equal. You want it to be equal on each side. And then if I have not seen Miss Beckman get up and walk, if I have not seen that, then I would have her ambulate. I want her to walk about 10 feet, and that way I can assess her for any sort of fall risk. I can see if she's steady. Is she steady when she walks? Does she need an aid? Like, is she holding onto the side of the bed or the bedside table when she walks? Or does she need assistance from another person? And so we would do this at that time. And our final body system that we'll go through is the integumentary system, so our skin. You're going to look at the client's skin. Is it warm? Is it dry? Is it intact? And what color? You know, are they a normal, healthy pink, or are they blue and in distress? And so that can tell us a lot. Are they diaphoretic? Are they sweating? You know, what is something visible that you can see? We also will ask them if there are any lesions or rashes. Do they have any wounds that we specifically need to look at? Especially you ask this person who is alert and oriented these questions. But we also want to visualize as well. And so turgor is one of the things that we check for as well. And so when we check for turgor, we're checking for dehydration. And we can do this in a couple of different spots. On a client who's young and like Miss Beckman, what you do is on the back of the hand, you can actually pinch up the skin. And if it stays up and stays tinted, then that's a sign of dehydration. But for elderly people, this doesn't always work. And so we can move to the sternum at the top part of the chest where their skin may not be so loose. And again, you can pinch it up and let it go. And so if it remains tinted, then we have a positive turgor. We also, as we've talked about, any sort of breakdown on the skin, we want to check for pressure ulcers. And so we would ask that client to turn over so I could see their backside, which is very important. You want to check all of those pressure points, that sacrum area, the hips, the elbows, the heels. And so you're going to look at all of those points for any sort of breakdown from a pressure ulcer. You're going to check for redness, the ears. Where else, Miss Beckman?
If they're depending on what position they're lying in, if they're side lying, we want to make sure we check the side of the knees, the outside of the ankles, the hip bones, and then potentially the shoulders if they're turned on their side.
Yes. And we also check surgical sites and dressings. And so if they have had surgery or they have any bandages, we want to actually look at that surgical site if we can. If the physician hasn't taken off that first dressing, then we will document that dressing. We'll document it if it's clean, dry, intact, if there's not anything there, or whatever you see on the outside. If there is some sanguinous or serosanguinous fluid, if it's dry, if it's moist. And then finally, we're going to assess the IV site. And so Miss Beckman has an IV over here. And so we're going to look at it. We're going to check it for redness. We're going to check it for any swelling. We're going to check for any edema around it. We're going to check that it's patent as well, and if it's flowing, we're going to check again that patency, that the IV pump is running correctly. We also will check that date on that IV as well and make sure that it is dated correctly and still within a good time limit. So this concludes our head-to-toe assessment, and good luck.